HEAL stands for Health, Equity, Action, and Leadership.
What HEAL is, on one side, if you were just to unpack the basics of HEAL, it's a 2-year fellowship in global health where you get a master's in public health, you get further training in global health. The first stint is 3 to 4 weeks in San Francisco, and it's all health professionals in the HEAL fellowship coming together. So after those 3 weeks, all the fellows go to their respective locations.
We are blessed to have an extremely talented and dedicated group of 22 inaugural fellows from 10 sites around the world. We brought these HEAL fellows to a training, and what we saw was incredible. We saw a community health worker from Nepal collaborating with a physician from Navajo Nation. We saw a district health officer from Malawi learning from a Liberian nurse. The connections that are made during this fellowship will blossom into lifelong collaborations in the service of the poor. And we're just getting started. In the coming years, we plan to scale to dozens of sites and hundreds of fellows who make serving the poorest of the poor a first choice.
I see it more as a movement. I see it as this network of international solidarity between health providers in the United States and Navajo Nation and so many countries from Haiti to Malawi and many places in between. These health providers simply want to get better at providing life-saving care to some of the most vulnerable populations on our planet. HEAL is a vehicle for these providers to learn together in a community. Our fellows come from all over the world, but they share similar frustrations in working in health systems that don't always benefit the poor. Put simply, we aim to provide our fellows with the support and skills necessary to thrive in environments and to ensure we can get better at having people not die from diseases we know how to treat.
The thing that impacted me the most was just how unpretentious and open and accepting everyone was. And it's just a beautiful feeling to be able to walk into a group of people who are able to put aside egos.
Probably about just the camaraderie that was developed here, the bonds, and I really feel like I've developed lifelong friendships with people here, and then also people that were so open to hearing, learning, and then knowing about my background, learning about where I came from, the plight of the people, like the Native American people.
Sometimes we feel really isolated. We work up in the mountains and daily work can be really hard. There's a lot of suffering to carry on our backs. And now I can come back and say, we're not alone. There's a lot of people trying to improve the world like we are doing, and they are there, and they are there, and they want to support you.
I had a lot of preconceived notions about what global health was. And from the very first day, I think all that changed. This is not something they teach in medical school. It's not something you learn in residency. It's not something you learn out in the hospital working. A lot of these notions that were being discussed and being taught were completely new to me. And for me, it was, for the lack of a better word, it was a mind-blowing experience.
By design, we want the HEAL Fellowship to create change agents who are nurses, who are nurse practitioners, who are community health workers, who are doctors, who are pharmacists, because it really is a care team that would really move the needle in global health equity.